You should be aware of your motivation before seeing a patient. You may be called to a code blue or the emergency room, you may be asked to check a patient by a nurse, you may receive an order for respiratory care to evaluate and treat or to assess and treat. In all of these cases, you should at least have a vague sense of why you are seeing the patient. Understanding why aids in concentrating on the necessary actions. What can you anticipate? What information should you gather? What inquiries must you make? What signals need to be looked for? What observations could you be able to make? How will this affect the patient's emotional state? Today we will talk all about health assessment and its types. A health assessment is a plan of care that outlines the unique needs of a person and how those needs will be handled by the healthcare system or a skilled nursing facility. An assessment of a person's health is performed as part of the admission process at a skilled nursing facility. The purpose of a health assessment is to determine an individual's current state of health by conducting a physical exam and gathering medical history. It is done with the purpose of detecting disorders early on in persons who may appear healthy and feel fine. An individual's health status is evaluated along a spectrum called the health continuum as part of the health assessment process. The objective of the assessment is to determine where the individual now is on the health continuum because this determines how to approach and treat the person being assessed. Depending on an individual's position along the health continuum, there are a variety of approaches to healthcare that can be provided, ranging from preventative care through treatment care to palliative care. It is not the treatment nor the treatment plan that is the issue. The plan that is related to the findings is called a care plan, and it is preceded by specialization, which might be anything from nursing to physical therapy to medicine. The majority of health evaluations fall into one of these four categories. 1. Initial assessment. Usually, the attending doctor or the nurse in charge of admitting patients do this step, maybe in the nursing admission notes or assessment. Is a thorough look at the patient's current health, past medical problems, social history, and anything else that may be important? Even though respiratory care practitioners don't usually do this kind of exam, you need to know what it tells you. Even though this is the case, it is still important for you to know the information. Before you go into the room with the patient, it would be helpful to know if they are blind or have trouble hearing. If you knew this about them, you would be able to talk to them better. Most of the time, how carefully a patient's medical history and physical exam are written down depends on how long they stay in the hospital. When a patient is admitted again and again because of a recurrence or worsening of a chronic condition, both the doctor and the nursing staff at the facility where they are being treated know them well. Because of this, it is possible that there will be references to see earlier medical records instead of a reiteration of what has already been written down. So that no information is said more than once, this is done. If you want to know more about what has happened with the patient and how their current condition has changed over the course of their treatment, you may need to be able to find the patient's old medical records and read through them. The patient's medical history can be used to do this. 2. Focused assessment. During this type of evaluation, the focus is on one problem or disorder in particular. A single subject evaluation is another name for this kind of evaluation. Any doctors who are called in to help with the patient's care will have their findings written down. These reports are likely to be found in the patient's medical chart under the heading Consult Reports. This is because any specialist doctors who are called in to help care for the patient will be called in to help care for the patient. Auxiliary or allied health providers such as respiratory care, physical therapy, and occupational therapy will do focused assessments on patients when asked by the patient's primary doctor or when a protocol tells them to do so in order to diagnose and plan treatment for disorders in their area of expertise. The provider will use the results of these tests to figure out what's wrong with the patient and how to treat it if it's in his or her area of expertise. The results of these tests will be used to make a diagnosis and decide how to treat the patient for conditions that fall under the doctor's purview. 3. Emergency assessment. In an emergency, this kind of exam needs to be done by pretty much everyone who has ever talked to or helped the patient in any way. Respiratory care practitioners who are part of rapid response teams, who are sent to code blue situations, or who are sent to the emergency department call to do emergency assessments as soon as they enter the patient's room and until the situation is no longer considered an emergency. In the process of giving medical care to a patient, The bedside is often the place where unexpected medical emergencies happen. Because you might be the one who has to decide and act, it's important to know the signs and symptoms that indicate someone needs emergency help. 4. Ongoing assessment. Everyone taking care of the patient has a duty to know how the patient is feeling physically and mentally, as well as how the patient is responding to the care they are getting. This means paying attention to how the patient reacts to the care they are getting. As a trained specialist in respiratory care, you need to use your evaluation skills to make sure that your patient is getting the best care. Is there any proof that this medicine works? Have you accomplished the goals you set for the treatment? If so, you should think about whether you want to keep getting treatment. Does the patient seem to be getting better, or does their condition seem to be getting worse? So, that's it for today's video. What do you think of this video? Hit us up in the comments and let's chat. Don't forget to like, subscribe, and turn on the notifications for our channel so you never miss what's coming next from us. Thanks for watching.